Hi guys, today's topic about anatomy of the parathyroids. These parathyroids are small, ovoid, yellow brown color, while thyroid is reddish brown color, or this parathyroid is yellow brown color, or you can say caramel color of the parathyroids. They are usually four in number, two superior and two inferior. Developmentally, if you see, these are the pharyngeal arches. So this is first, second, third, fourth, and sixth. Fifth is disappeared. So this parathyroid is developed from these pouches. So pharyngeal pouch. This superior parathyroid developed from fourth pharyngeal pouch, while this inferior parathyroid developed from the third pharyngeal pouch, because this third pharyngeal pouch also develop the thymus. So during descent, this thymus, see, this is thymus and this is the parathyroid. So during descent, this thymus goes in location and taking this parathyroid with this, leaving here behind, just behind the inferior pole of the thyroid, this parathyroid, and this thymus is located in the superior mediastinum. So during descent, because of this inferior parathyroid goes in the inferior location to the superior parathyroid, and superior parathyroid develop from this pouch and become just middle of the thyroid tissue, behind the middle of the thyroid tissue. See, this is the behind picture of the back picture of the thyroid. This is isthmus. These superior parathyroid are located here in the middle of the thyroid tissue, middle of the thyroid lobe. And this inferior parathyroids are located here. They goes more inferior location. Inferior parathyroid, superior parathyroid. So these are located just at the behind the inferior pole of the thyroid tissue. So this thyroid, inferior parathyroid developed from third pharyngeal pouch, while this superior parathyroid developed from the fourth pharyngeal pouch. Size of these thyroid parathyroids is about 5 into 3 into 1 mm. They are flattened, overt shape, and weight of these parathyroid is approximately 30 to 40 milligram. Weight of this is about 30 to 40 milligram. And these parathyroid mostly supply by the branches of the inferior thyroid artery. In 90% of cases, blood supply of inferior parathyroid is by the inferior thyroid artery. While this, in 10% of cases, this parathyroid may be supplied by the branches of the superior thyroid artery. That may be anastomosis branches with the inferior thyroid artery or branches of superior thyroid artery, and sometimes this also supplied by the inferior thyroid thyroid artery, that is in 10% cases branches of thyroid arteries. So mainly this parathyroid are supplied by the both superior and inferior supplied by the inferior thyroid artery. Sometimes may be supplied by branches of superior thyroid artery, branches of the thyroid artery. So that variation may be there, but mostly supplied by this. Mostly this superior parathyroid is always in constant location. It is always located middle of the thyroid lobe behind the, and this location is always constant. If you see, this is the inferior thyroid artery and recurrent laryngeal nerve is coming here. So this location of superior thyroid is, you can say, during surgery, it is about this behind picture. So if you see 3D dimension, this is almost 1 centimeter supralateral. Supralateral. This superior parathyroid is about 1 centimeter supralateral from this transection of this inferior thyroid artery and recurrent laryngeal nerve behind the posterior thyroid lobe. So this location is always constant, but this inferior parathyroid may be variable in location because of descent. It may be in the retroperitoneum, it may be in the with the thymus superior mediastinum, it may be in the line of the development with the thymus below the inferior pole, but most commonly they are found in the about just behind the inferior pole or near the inferior pole of the thyroid lobe. And they may be sometime 4 to 6 in number. Most common number is 4 in number, 2 superior, 2 inferior. Now, this venous drainage, mostly superior parathyroid drain into middle thyroid vein if present. Otherwise, goes into the inferior thyroid vein, ultimately go into brachiocephalic vein into the venous circulation. And these are the mostly supplied by sympathetic plexus of the middle or inferior cervical plexus. But they are not under neuronal control. They are under control of the serum calcium. So, serum calcium regulate the PTH secretion from the chief cells or principal cell of the parathyroid. If calcium increase, PTH level is decreased. If serum calcium is increased, this PTH secretion will be increased. If you see microanatomy of this parathyroid, these are having two type of cells, chief cells or principal cells. These cells, chief cells or principal cells, secrete this PTH, and other cells are oxyphil cells. Oxyphil cells. Their function is not known. So two type of cells, chief cells and oxyphil cells. Now, during surgery, most common adenoma is arising from the inferior parathyroids because of variable locations and difficult to find them out from the neck. So best method to, you can go for ultrasound, CT scan or system scan. So better is system scan to find out this system 99 technician scan. They can identify because of This system goes in the mitochondria. Mitochondria in higher concentration. These parathyroid having higher concentration of mitochondria. Now some special points about parathyroids. First point, how to differentiate between thyroid, lymph node, parathyroid and fat. During surgery, how to differentiate between thyroid, lymph node, parathyroid and fat. This thyroid color is reddish brown color, while this lymph node color is yellow white color. And these two are firm in consistency. Size of thyroid is quite big. This parathyroid color is yellow brown, while this fat color is yellow. This is soft in consistency, while this parathyroid is also between soft and firm consistency. This is firm and this is also firm consistency. And color is red brown, lymph node yellow white color, while this parathyroid yellow brown color and fat is absolutely yellow in color. Second, if you put this into water and saline, this is the glass of water or glass of saline. If you put these into the saline, this fat will float. Rest will sink because density of this fat is less than 1 gram per ml, while these three having density more than 1 gram per ml. Because what is density? Density is mass divided by volume. If you see, if you put all four into this glass of water, so fastest to sink is the thyroid. Thyroid will sink fastest, while second one is lymph node. Second to fast sink is the lymph node. Third one is parathyroid. Third to sink is the parathyroid, and this fat will be float here. So sequence of sinking, first is thyroid, lymph node, parathyroid and fat. If you are dissecting into fat and if you find this parathyroid, you can put in the saline during surgery. You can at least having some idea what you are dealing with. So in fat, take some sample from this dissection tissue. If you are confused, put in the glass of water. You will avoid the inadvertent dissection in the fat. So this parathyroid will sink in between. Second special point is this oxyphil cells. This second type of oxyphil cells are unknown in function and they are not present in the childhood. They comes at puberty. So that cells are appear at the puberty. Third special point is auto transplant or allotransplant. These parathyroid, if dissected during the surgery, you can reimplant in the sternocleidomastoid muscles. And this parathyroid, without testing the graft versus host reaction, you can implant in another person. If during total thyroidectomy, these parathyroid are dissected completely from the bed of the thyroid, you can implant from the relative this parathyroid without doing any HLA or ABO grouping testing. So this parathyroid can be transplanted in another person if needed. So these are the special points about this parathyroid. Thank you so much.